working on the respiratory system, right? Okay, rhinos, rhinitis, rhinorrhea, runny nose, inflammation of the nose, rhinoplasty, plastic surgery of the of the nose. That's very commonly done. Laryngo, usually it's a voice box, larynx, okay. Laryngotomy, laryngectomy, usually they have to perform the procedure if there's any kind of tumor involved that they have to remove it, okay. One particular kind of cancer that usually occur in the larynx area or in the oral cavity area is the squamous cell carcinoma, okay. It's a very nasty tumor in the head and neck area because it goes everywhere to the lymph node, to the lung, and all those places. So it's not a good disease. It's very bad. Tracheotomy, the trachea, the windpipe, and again, sometimes for patients that have problem breathing or for some reason it could be due to malignancy or other disease, they have to open a little hole here for them to help in breathing, okay. Bronchoscopy. Bronchoscopy is one of the most common procedure performed in their clinical service here because we have a very large transplant unit. They do a lot of the lung transplant. And for those lung transplant patients, they need to be monitored constantly, at least every month or every 3 months they need to come in for a checkup. One of the reasons for those transplant patients is when you have an organ, a new organ from a donor that transplant into a different bodies, your own system tend to reject it. Okay, even though they have do all the blood compatibility, all the HLA matching, everything, but still your body will look at that new organ as a foreign material and they try to reject it. And one way the body that reject it is your immune system try to fight it, get rid of it. Okay. And because of that reason, for all those transplant patients, whether it's a kidney transplant, lung transplant, liver transplant, etc., they need to lower the immune system of the body in order for the new organ to have a chance to stay in there and start their function. And when you lower the immune system of your body, what happens? What's going to happen if your immune system go down in your body?
You're more likely to get sick.
You're more likely to get sick. You could get a lot of different kind of infection. Okay, the kind of infection that normally would not kill a healthy person, it would become a very serious disease in this kind of a transplant population. Okay, so for those patients, they need to be monitored constantly. And one of the things that the easiest to get infection is in the lung, whether it's a kidney transplant, liver transplant, or lung transplant. And inside our body, we normally already have certain amount of bacteria or fungus that is residing inside our body. But since we're healthy, they don't bother us. We just kind of live with them. Okay. However, once that patient's immune system is lower down, the infection, the organism that is inside their body or from the outside could start to get activated. Okay, and get really active. So it could make the patient very sick. One of the things, the procedure that's done here very commonly and send the specimen to cytology is the bronchoscopy. What they do is they do the bronchoscope into the lung, okay, usually, and they flush the saline, deposit the saline into the lung, flush it out, kind of rinse it, and then suck the fluid back out. And those fluid, they usually send to cytology. We call it bronchial alveolar lavage, okay, BAL specimen. Those are the specimens that when we process, we look at opportunistic infection, meaning that any kind of infection that the patient may have, any kind of disease that the patient may have, chronic disease, or any kind of malignancy that the patient may have. Okay, so those are the three major purposes for the bronchoscopy specimen that we receive at least 4 or 5 every day when doing that. Okay, pneumo, breath, air, lung, tachypnea, dyspnea, apnea, those all, when you say the word pnea here, it's all related to breath, breathing, okay? So, lung, pulmonary artery, phthisis, meaning spitting, coughing out, hemoptysis, okay? Hemoptysis is one of the major symptoms the patient have. The sign of having lung cancer is they cough up blood, okay, usually. And reconstruction, plasty reconstruction, so we call rhinoplasty reconstruction, plastic surgery of the nose. Okay, all right. Okay, Adam's apples, yeah, this is when everyone is familiar with that. Adam's apples only appear in men, right? Women do not have it. All right. Respiratory disease, pneumococcus, that's abnormal condition of the lung, pneumonia, a lot of time, and black lung, minus lung, when you breathe in a lot of those pollutant and chemicals and dust particles, they sort of accumulated in the lung. And you know that the lung needs to be a very clean organ in order to have the exchange of the oxygen and, exhale of the carbon dioxide. So nosebleed epistaxis, fancy name for nosebleed. A lot of time it could be due to dry weather when your mucosa in your nose is very dry and the capillaries kind of break and you have a little bit of nose bleeding. Okay. A lot of time when you blow your nose a lot or if you blow it too hard, it can also break the little capillary and you get a nosebleed. Cystic fibrosis is a inheritable disease where there's overproducing of mucus in the body, in the lung. Normally, between your lung and the pleural cavity, there's a small amount of fluid that is sort of just lubricant, hosting the organ, the two lungs, okay? But cystic fibrosis are the mucin, the columnar cells, we looked at the columnar cells yesterday, right? Those tall columnar shape. Inside the cytoplasm, they are full of mucin. That's one of the major functions of the mucin-producing cells, what we call the columnar cells. They produce the mucin in a small amount to lubricant, okay, to function as other benign function. However, in cystic fibrosis, there's something wrong with it, and they keep overproducing the mucus. And what happened is the mucus accumulates so much in the lung and is sitting in it all the time, that whenever there's something sitting in the lung, that a lot of time lead to bacterial overgrowth. The patient can have pneumonia, difficult breathing, and a lot of chronic disease. Okay. And usually for cystic fibrosis, they try to have the patient have a lung transplant if it's possible, but sometimes it's hard. The transplant list is usually very long, and they have different kind of criteria for the patient to qualify, and if they meet the criteria, meet all the steps, then they will be on the list. Okay. So, emphysema, COPD, that's another name for chronic obstructive pulmonary disease. This is very commonly seen in a lot of people, sick people or elderly people. Okay, it just means that they have short of breath. The lung is not function very well. That's all. Could be due to smoking. It could be due to other kind of disease. Atelectasis, collapsed lung. Okay, respiratory system procedure. Pulmonologist is a specialist in lung disease. Respiratory therapists, they are specially trained technicians that usually work in the clinic of the hospital. For example, I don't know if you have seen those little devices that the respiratory therapists usually work with. They have a little thing that have the measure of the air, so they have the patient blow in the air and measure how much of the volume that they are bringing in and out. Okay. That's one of the things that they do, is to work with the patient on inhalation and how to expand the lung. Okay, respiratory therapist. Okay, pulmonary angiography, special X-ray of the lung. Laryngoscopy, to look at the larynx, they use a little endoscope. Okay. And the trachea intubation. Usually there's not enough oxygen supply. People that are very sick, they cannot really breathe on their own. They do not have enough oxygen, so they need to have a tube stuck in their the windpipe to help them breathing. Okay. could do the quiz later. Let's go on to urinary system. Okay. Urine specimen. There are three major type of specimen here that we see a lot in cytology besides the pap smear. Okay. One of them is the bronchial lavage, the pulmonary specimen, like I just mentioned. The second type is the urinary system. Okay, we have a lot of the urine specimen, bladder irrigation specimen, renal pelvis washing specimen, catheterized urine, etc. Okay, so those are major type of specimen. Usually they are from patients that have a history of bladder carcinoma. Okay, for renal disease, urinary system, the specimen do not help much. They usually go to chemistry. If there's any kind of renal disease, they wanted to measure the creatinine, the bilirubin, okay, all those things that are secreted in the urine. But for the morphology, when we look at cancer cells or if there's any kind of infection or virus, fungus infection in the urinary bladder, then it comes to cytology. Okay, so that goes to the different kind of specimen too. I don't know if you have seen it. Sometimes in the clinic, they gave the patient a big plastic mug to say collect a 24 hours urine, versus they give them a little cup and say just pee in the cup, then give me a specimen. Those are the difference. Okay, the one that pee in the little cup usually go to chemistry just for a little bit of dipstick test, and then the majority of those little cup specimen go to cytology here, that we look at the cells visually. However, that big plastic cup of, I think it's like at least a liter of those urine that collected over 24 hours, those they need to measure a lot of the function of the patient, okay, of the kidney, how well that they produce the urine over 24 hours period, how much of the creatinine has been excreted, how much of the bilirubin has been excreted. So they need it over a period of time. Whereas for cytology, we just need a sample to look at the cells. Okay, so nephrorenal, they all refer to kidney. Water hydronephrosis, there's abnormal condition involving backup of urine into the kidney. So as you know, kidney is probably one of the hardest working organ in our body. It's constantly filtering all the toxin, all the abnormal stuff, and then excrete out through urine. However, if the kidney is not at 100% functioning, there's going to be some little toxic material or substance that is built up over inside your body because it's not completely empty into the bladder. Okay? So that's very important, and thank God we each have two kidneys. So if one is not working well, hopefully the other one will compensate. Okay, and if both kidneys doesn't work well, then the patient have to have a kidney transplant. So cystal is bladder cystitis, cystectomy, removal of the bladder, usually in the condition of blood cancer. Pyelo is a renal collecting duct. Pyelogram, they usually look at it X-ray. They have to have some sort of a dye, either inject it through your blood or they drink something. So when they take the pyelogram, it will show up with the little color material. Okay. For the kidney, the urinary system, it involves both kidney, okay, the ureter, the bladder, and the urethra. So it's a whole system. It's not just one thing. Whenever there is tumor cells appear in the urinary specimen, could we say for sure that this is coming exactly from the bladder, or is coming from the ureter, or is coming from the urethra, or is coming from the kidney? Do you think? Can we say that? Pinpoint? Exactly?
No.
No, because it's the whole system, okay? And all the cells in the urine, they just drain and collect it into the bladder. So whenever we see abnormal cells in the bladder, in the urinary specimen, we cannot say for sure that whether it's originated from the bladder itself or from somewhere else during the whole urinary system. Okay, so that's another thing too, is cytology usually go along with histology. We don't just work on our own. When we have a specimen, then we usually look at the biopsy to see side by side whether it's exactly where is this coming from for the patient treatment. Okay. Okay, yeah, here we just explain about urine. Oligo usually mean they're scanty, less than normal. Pexy is to fix it, okay, patch it up, almost like. Okay. Okay, urinary disease, nephrosis, inflammation, kidney stone. There's another name for kidney stone, we call it calculi, calculi, calculi. Urethritis, inflammation of the urethra. Nocturia, usually frequency urine during the night, that occur a lot in older patients. Okay. In urethritis, involuntary incontinence is like bedwetting, usually in little kids or patients that have lost the function to control. Okay. Talk about nephrologists and urologists, specializing in kidney disease and urinary tract disease. Okay, cystoscopy, looking into the urinary bladder with a fibrotic instrument. Cystoscopy is a very uncomfortable procedure. Okay, it's very expensive, and what it does involve is it usually has to insert a little catheter through the urethra. And that's very painful sometimes. Okay. Intravenous pyelogram, we talk about that too. Special X-ray showing the drainage appendage of the kidney. Retrograde pyelogram. This is something that do side by side. Sometimes they do that. This one they do a dye for the X-ray to see how the flow is. Okay. Voiding, empty. Voiding is emptying the bladder. Okay. Dialysis is procedure of cleansing the blood. When the patient, the kidney function had completely lost or almost gone, and they're waiting for a kidney transplant, what happens during that period of time is your body do not have the function to cleanse off the toxic material and the substance, and it needs the machine to help. So in dialysis, what it usually does is they get the blood out, go through a machine to recycle the blood and get rid of the toxin, and then pump back into the patient. Okay, it usually takes 3 to 4 hours for the patient, and they have to do it at least twice to 3 times a week, depending on how bad their kidney function is. Okay. Lithotripsy, crushing kidney stone. Sometimes they have kidney stone that is extremely painful. Anyone that have the kidney stone before, usually occur in older patients, they have this pain at the back. They usually call the back pain, but it's not really the back. It's actually more on the lateral side, and it's extremely painful when the kidney stone is there. Okay. So, okay. All right. So I think let's stop here. And then, any questions so far? No? Okay. So let's move on to our lecture. Okay. So first of all, I have some gross specimen picture in here. Are you guys comfortable with that, or are you feeling squeamish about it? Okay. No? Okay, good. Okay. All right, so let's start. If some of you have already taken this in high school, this is a review for you, okay, if you have known some of this already. Okay, so this is the anatomy of the female genital tract, okay. So this is the side view. Basically, I'll go through each part in more detail. And this is from one of the textbooks that after they open the abdomen, that you can see the uterus here, the ovary, and the fallopian tube. Okay, so this is the side view. where this is the bladder and the uterus. That's one of the reasons, see, the uterus is sitting on the bladder. So for women who is pregnant and the baby is growing, like keeping pressure on the bladder, and that's why pregnant lady usually have to go to the bathroom all the time. It's because the baby is sitting on the bladder and they feel like, she needs to empty her bladder more often. Okay, so this is a normal uterus removed from a young woman. Okay, you can see the uterus here has a very shiny kind of a surface, very smooth, healthy serosa here. However, the ovary is not in the normal size, and I think that's the reason that they have to remove it. This is a gigantic ovary, okay? A normal ovary should probably be maybe 1/4 of the size of this one. Okay, so obviously she has some sort of a ovary disease. This is a fallopian tube, okay, and here's the cervix right here. Okay, so the most outer part of the female genital tract start with the vulva area. Okay, that's usually the most outer part. And it consists of two folds, what we call the labia majora and the labia minora. Okay, labia just means lips. It's kind of shaped like a lips, okay, on the outside. This is the entrance to the vagina. The vagina is inside, so the vulva is the part that is exposed to outside in the air. Now, in the labia majora, is practically just an extension of the skin. So it has similar to the surface epithelium, the skin, very flaky sometimes, okay, it's tough and protective. Labia minora is the smaller fold, like around here, okay. So it's in between the surface skin and the vagina. So the epithelium is a little bit more sensitive and not as tough and flaky or keratinized like the other, the outside. Okay, so, and then clitoris. Clitoris is the little organ part that's sitting on top of the labia minora. It's the female counterpart of the penis of the male, and it has a lot of the nerve bundle, so it's very sensitive to touching, examination, things like that. Okay, and urethra. The female urethra is just a little bit. I think you couldn't really see it, but it's like somewhere around there. Okay. So. Okay, the mucosa of the vulva is stratified squamous epithelium. A lot of the morning, Ling. Hey. A lot of the cells. Ling, why don't you come in here? We'll introduce you to the ladies.
You're in the class.
Yeah. That's okay. We'll just say hi real quick.
Hi.
This is Ling
Hi.
Wang. She is our admin lady here, so she helps cytology a lot. You'll see her all the time. Okay, when we have conferences, we have cases, so she's part of our team here. Okay.
Welcome.
Okay.
Thank you.
I got your name, so I know who you are. Okay.
All right.
Sorry.
Okay. So mucosa. Okay. Stratified squamous epithelium. This is a very important type of cells, okay? In the female genital tract, especially the pap smear specimen that we look at, one of the major type of epithelial cells that we look at are the squamous epithelium, okay? What does stratify mean? Layers, yeah. More than one layers, okay? So there's different layers. One of the reasons that the squamous epithelium need to be multiple layer is their major function is for protection, okay? If it's only one single layer and you scratch your skin, then it really hurts, okay? So that's why it have different layers. That the bottom layer here, this is called the basement membrane, okay? At the very bottom, this is a submucosa. So the surface epithelium is this major part here. And if you count the cells, you probably could see maybe 10, 20 layers stacked all together. The cells start at the very bottom and mature up, okay? So we'll get into that more. So this is the mucosa surface. This part here is the submucosa underneath. Okay, so vagina. So we're moving in from the vulva area here into the vagina area here. Okay, the squamous epithelium sort of extend into the vagina. If you look at it grossly, this is the vagina. Look at the shiny, smooth epithelium and all this material here. Those are the mucin. It acts as a protective and a lubricant. Okay. For patients that are getting older and older, people, older female, they do not have as much of the secretion in the body, and they have a dry vagina, and it could lead to inflammation, painful sometimes, okay, itchy. So the mucin producing function here is a very important lubricant and material. Okay, so notice that it's not a one flat layer; it's sort of a wrinkled layer. Okay, and here is the cervix area. Okay, they open it up, they cross section the organ, and then they open it up for you to see. Usually it's kind of a close. Okay, so the uterus is this part. This is the anocervical canal. Okay, you can see there's some blood here, all this redness. Okay, so let's look at the mucosa a little bit more in detail. The vagina is a fibromuscular canal with a wall consisting of 3 layers. The very top layer here is the mucosa, is non-keratinized stratified squamous epithelium. Now, keep in mind, you are going to see the word keratinized or non-keratinized throughout your study. Okay, it's very important to remember the squamous epithelium in the vagina area, in the cervix area, are non-keratinized. Once they become keratinized, that means there are different changes going on already. Okay, so in the normal vagina mucosa, they are non-keratinized, stratified, meaning layers of squamous epithelium. And then the dense lamina propria is this area here where there's smooth muscle. Okay, the very elastic fiber. All this, the muscle is right here. But all these elastic fibers have a lot of veins. And then plus, underneath the muscle layer here has the circular muscle and the longitudinal muscle that it could expand the vagina. Okay. Think about it for a minute. When a woman gives birth to a baby, how big is the baby? 6 or 7 pounds, right? Imagine that this little vagina area could expand to accommodate this 6 and 7 pound baby to go through the birth canal and go, outside to the mother's body. So there's a big elastic function for the vagina with the muscle area here to expand and collapse. Okay. And serosa is the very top bottom here. Usually has a lot of elastic fibers and merges into the bladder and the rectum. Okay. So in cytology, we would not be able to see all the cells underneath this layer. We mainly see the cells at the top surface layer. Okay, here's another bigger picture of the epithelium. Again, the top layer is the non-keratinizing stratified squamous epithelium. You can see the cells, basal membrane here. Okay, aglandular meaning there's no gland. It's just surface epithelium. Okay, they're lubricated by mucus of anocervicals and Bartholin glands underneath, and it undergoes cyclic changes with the menstrual cycle. This is one of the most important things that Dr. Papp discovered when he was experimenting with the guinea pig, is he noticed that every month during the cycle of a female guinea pig, the cells changes according to the menstrual cycle. Okay, so that's one of the biggest discovery that he had. See, the squamous epithelium is kind of all lying flat, okay, in multiple layers. Okay, cervix. So this is the front view of the cervix. Okay, this is what they call the cervical os, and this is the ectocervix. So this is a very normal healthy looking cervix that has a very smooth surface, a little bit shiny with the mucus. There's no redness, there's no white patches or bleeding or any kind of abnormality appearance. Okay, so this is a cartoon of the system. Here is the cervix. So inside, those are the kind of cells that we do, that we can see underneath the microscope. Okay, so this is the endocervical canal. Okay, this is the squamous epithelium. These are the columnar cells. Okay, here's a tissue biopsy of what the cells look like. Again, here is the surface epithelium, cervical os here, open into the endocervical canal. Okay, ectocervix. Again, very similar to the stratified squamous epithelium of the vagina area. It basically just extends from the vagina into the ectocervix. And you can see that here, multiple layers of cells. So the cells start from the very bottom, and over time during menstrual cycle, the cells mature with the estrogen, mainly the estrogen function. The cells mature, getting bigger and bigger and bigger and bigger, and then it goes to the top here. At the very top, the cells naturally falls off and die, and then the new layer will replace. Okay, then it goes through a cycle every month like that. Okay, so here are the difference between the ectocervix and the endocervix. The ectocervix, we see squamous epithelium. Okay, the endocervix, these are the glands that we see, endocervical gland. Okay. Notice that how many layers of this gland compared to the squamous? Is that single layer or is that multiple layer?
Single? No.
Single. Yeah. In the gland, there's only one single layer. Okay, see, this is the opening. All this white space is the opening that the gland, the mucin produce, secrete into this empty opening. Okay, and then it transfer into the body. But, so we're looking at the cross section of the gland. The cells that are lining the gland is one simple columnar shape, one single layer. But for the squamous epithelium, it's multiple. You can see. Okay. And they each have different functions, and for that reason. Okay, squamocolumnar junction, aka transformation zone. This is too long. We usually don't call it squamocolumnar junction. We should just call it T-zone. Okay, so in cytology, you hear about when say T-zone, T-zone. That's what we refer to, squamocolumnar junction. So on the tissue layers, this is the ectocervix. This kind of epithelium, okay? Squamous epithelium, ectocervix, and it transfer into this area that we call it T-zone, squamocolumnar junction, and then it gets into the endocervix, which is this area here, okay? So why do we call this squamocolumnar junction? Because it's a transition zone in between. The cells here have both characteristics of the ectocervix and the endocervix. Okay, they look like similar to each other on this side. And one very important reason too is transformation zone is where the cervical squamous cell carcinoma mainly arise. Okay, a lot of the abnormality of the cells, a lot of the virus infection occur mainly at this area. A lot of the cells mutations, changes, mainly at this area. So this is an extremely important area when we look at the cell sample from here. Okay. Okay. The transformation zone also changes with age. At birth, the T-zone is sort of at the outer cervix. Okay. And then as the women getting older and older and older, the T-zone kind of shift up Okay, so this is the squamous epithelium outer. This is the endocervix, okay, columnar cells. In the young adult reproductive age, the T-zone is right around the cervical os area here. However, as the lady getting older and older in the adulthood and postmenopausal, the T-zone is going to shift up higher into the endocervical canal. Okay. Okay, here's another cartoon to show you the cells. In columnar cells, tall shape, like a column. Okay. In the outer cervix is squamous, stratified, multiple layers. This is one single layer. At the T-zone here, we see both characteristic of columnar cells and squamous cells, sort of mixed together. Okay. Here in the cartoon, you can really see the cells distinguished one by one. But when they take the sample and put it on this fluid on the slide, the cells are all mixed together. They're not going to be separately so easily. Okay, so that's why we need to recognize the cell and see the epithelial cells, the surface epithelium, multiple layer, and then it started to go through changes. And here you can see the columnar shape on top and sort of the squamous at the bottom here. Okay, and then when you go into here, it's all columnar cells. All right, so whenever you have problem, kind of refer to this cartoon. Okay, it's easier for you to see. Okay, uterus. Let's go into the uterus. Any question so far? No? Okay. Okay, this is the same picture again. All right. Okay, for the uterine, you don't really need to memorize all this particular thing, okay? All you need to memorize is in the vagina is lying by the stratified, non-keratinized squamous epithelium. In the cervix is lying by